coronavirus thing going on. The only fucking bad thing is that there's still no plan for the end of it. For all intents and purposes. A month ago, on April 5th, I wrote that. Well, you gotta read it from the person who's writing the article. They wrote that weeks into what was initially intended to be a short lockdown, there was no clear vision of an endgame for the White House. In theory, the lockdown was designed to slow the spread of the disease to give us time to catch up and prepare for what would happen when restrictions were relaxed. In the months since, we've had a lot more action at the state and local level, though that action has moved into a different direction at once. Los Angeles rolling out free universal testing in Massachusetts, building out a contact tracing army while Texas reopens dangerously close to its own peak and Georgia leans into its own coronavirus surge. That disarray is because in the White House and throughout the federal government, there is still nothing like a vision or concerted effort to coordinate a national response. On Tuesday, it was even reported that the squatter was disbanding the coronavirus task force, though on Wednesday, the squatter somewhat walked that back on Twitter in a thread that was really more self-congratulations and a job very well done for a job that he hasn't really done at all. How well have we done? Well, admittedly, aside from flattening the curve, in critical places enough to ease the burden on the healthcare system, the country has accomplished essentially none of the necessary preparatory work required to safely begin to reopen and return to some semblance of a normal life. It is true by nearly every metric, but let's begin with the testing, the most fundamental. On March 30th, when lockdowns were underway in the vast majority of American states, 117,450 COVID-19 tests were conducted nationally. According to the Lantix COVID tracking project on April 30th, a month later, it was up to 229,600. Testing capacity had only doubled during a month of lockdown designed presumably to buy time to mount a sufficient response. In the 2 weeks prior to lockdown, the capacity had grown about 15-fold, up from 7,658 tests on March 15th. Proportionally, then the country made considerably less progress during the lockdown than it had before, even in raw numbers. Testing capacity had grown only about as much during the lockdown as it had done in those 2 weeks before. How many tests would be needed to help safely reopen? As we are already beginning to go underway, estimates vary, but one commonly cited projection from Harvard puts the number at 500,000 to 700,000 tests every day, 2 to 3 times the capacity we have already. Another estimate comes from the economist Paul Romer, more than 20 million each week, or 3 million every day, and a third from one of the leading roadmaps produced at Harvard Safra Center calls for 5 million tests daily by June and 20 million every day before proceeding to a full reopening. 5 million is 25 times what we are doing now. 20 million is nearly 100 times more. Romer has sold his proposal is easier than the others because it does not depend on contact tracing. Large numbers of public health officials responding to each positive case, like detectives, making contact with those people the new patient recently encountered and advising them to be tested, quarantined, or both. But the even higher testing target put forward by the Safra Center uses both testing and contact tracers. How many of those would be needed? Last week, a group of powerful former federal public health officials, including Scott Gottlieb, who was once 45's FDA commissioner, and Andy Slavitt, who was once Obama's head of Medicare and Medicaid, called for around 180,000 of them. The other proposals range from 100,000 to 300,000. In response, NPR conducted a nationwide survey and found that 7,602 currently working across 41 states. Surge plans would bring that total to 36,587, barely a sixth of the estimated need. Hold on a second. When the White House first released its guidelines for opening up America again, on April 15th, it suggested that reopening would only be advisable following a downward trajectory of documented cases within a 14-day period. That is not the case for the U.S. as a whole. On May 6th, there were 23,841 new cases reported. On April 23rd, there were 7,588 new cases reported, and on April 28th, there were 22,541 new cases reported. And while some of those new cases reflect the expansion of testing capacity, the death tolls are far less ambiguous. On May 6th, there were 2,144 deaths from COVID-19 nationally. On April 28th, it was 1,369. On April 23rd, it was 1,721. On May 4th, the same day that the University of Washington's unreliable but influential IHME model literally doubled its projections for death totals by August 4th, A leaked report from the CDC suggested that rather than moving in the right direction, the death totals were likely to get considerably worse and very fast, with an average of about 3,000 deaths and 200,000 new cases a day as soon as June 1st. But it is worth looking even closer at the leaked reports because the much talked about headline numbers did not communicate all that well at just how dire the new futures depicted by the model really was. The mediation project, 3,000 deaths a day as soon as the end of this month, is quite horrific. A 50% increase above our current peak, but for the lifetime of the model's projection, no single day of data came anywhere close to as low as the median prediction. For the last 2 weeks, with the country's infection and death rates shaped profoundly by social distancing and shelter-at-home orders, the results have fallen at or above the model's 75 percentile projection. That percentile on June 1st yields a projection of more than 7,500 deaths every day. For most of the lifetime of the model, when the data reflected fewer lockdowns and less social distancing, like what we are going to see more of going forward, daily deaths fell at about or above the 97th percentile projection. For June 1st, that projection is up for 15,000 deaths every day. If that rate held for a month, it would produce 750,000 deaths just in June alone. And though the leaked projection ends on June 1st, the model shows a sign of flattening then, which means as far as the CDC is concerned, not only could the totals grow as the summer goes on, but they could accelerate. That this is not how the rest of the world is trending. Since the onset of the outbreak in the U.S., we have heard a lot about the contrasting experience in South Korea, which had its first confirmed case on the same day as the U.S. As recently as the end of February, the country had more confirmed cases of the COVID-19 than any country in the world outside of China. In April, 85 South Koreans died from the disease. In the U.S. that month, 62,000 Americans died, 85 every single hour. As Derek Thompson has calculated, and much more recently with many fewer resources, the state of Kerala in India has managed to drive all the way to the zero its number of cases through an aggressive regime of testing and tracing. That everyone has done as well as South Korea and Kerala. But consider this array of disease curves. Overwhelming data says openly, prematurely will increase cases and escalate loss of life and economic harm. Countries that acted late to impose social distancing and testing are suffering. Countries that acted early soon will safely restart economies and don't play with fire, basically. Every country in the U.S. has seen a steep decline in new cases, but the U.S., U.K., and Sweden, which has chosen to skip shelter-in-place guidelines and experience a more severe outbreak by design, in the hopes that the epidemic will pass through the population more quickly. As Ryan Cooper wrote in the week, at this point, the American response is functionally indistinguishable from Sweden. 45 was pursuing a herd immunity strategy, as he put it, whether intentionally or not. Such a strategy that the epidemiologist Carl T. Bergstrom and Natalie Dane wrote recently in the New York Times. It would result in millions of Americans' deaths, and that's millions plural. Why is the U.S. story so exceptional? As with everything in this pandemic, the story is complicated, and given how many levels of American government and leadership stumbled in the response, and how many nations and international institutions failed in the early stages, we should be careful not to overly attribute final outcomes of the disease to any single political decision or leader. But in this case, what counts as overly as the pandemic wears on, and even those other countries that had been slow to respond to the crisis turn their own corners, it is increasingly hard to hang our failures on everything but the squatter's refusal to lead, and the total vacuum that has opened up at the heart of what should have been the country's disease response. No clear federal clinical guidelines, no comprehensive national strategy of social distancing, a shelter-in-place, no clearinghouse of best practices about how to avoid spreading the disease, no rapid mass production of PPE or other necessary equipment, and above all, no use of federal powers to build out testing or contact tracing capacity. All of this could have been kick-started in January once the possibility of the virus might come here first announced itself, and there has been plenty of justified outrage that none of it was. But it also could have been kick-started in February or March or April, practically speaking, none of it was, though our politics and news cycles had been entirely eaten up by the pandemic at that point. It is unfortunate but unexceptional that the White House did nothing in January. In this, it was quite like most of its peer countries. What is remarkable and unforgivable is that it did almost nothing to make up for it in the 3 months that followed. Doubling down on policy of indifference whose most aggressive feature was the squatter's son-in-law, commanding FEMA to seize shipments of critical medical supplies on the way to states and hospitals to redistribute according to unclear criteria. Finally, in the last stimulus bill, Some money was allotted for this capacity, but the initiative didn't come from the executive branch, which spent the time urging states to reopen. The testing will only come slowly, and in the meantime, as MTA conductor Sujatha Gidla wrote in the Times this week, essential workers are being treated as sacrificial. On Twitter, Jeet Heer went even further. I cannot underscore enough that the plan is to make the working class into human sacrifices in the name of capitalism, he wrote. On his blog, press critic Jay Rosen was perhaps even more excoriating. The plan is to have no plan, he wrote, and to let daily deaths between 1 and 3,000 become a normal thing, and then to create massive confusion about who is responsible by telling the governors they're in charge without doing what only the federal government can do, by fighting with the press when it shows up to be briefed, by fixing blame for the virus on China to some other foreign element, and by flooding the zone with shit. Steve Bannon's phrase for overwhelming the system with disinformation, distraction, and denial, which boosted the economists call searchers for reliable intelligence. What makes this especially strange is that 45 is an invertebrate political animal, obsessed above all else with his own ratings and popularity, and should be able to see, as anyone else regarding the American political landscape can, that his political success depends on getting the disease under control and the economy somewhat back on its feet, but he hasn't even tried, not even bothering to feel out the options available to him by the crisis. He calls himself a true wartime power, expanded surveillance capacities, and much more leeway in other areas should he choose to focus on them, which is another reminder, if needed, that all Democrats have worried over the squatter's authoritarian tendencies the last few years. He has behaved in office much more like the con man he was in business than the Mussolinis, Erdogans, and Putins. He professed to admire in politics over the last few years at every juncture when faced with an opportunity to seize more power. He has chosen instead what he can do to avoid responsibility. He is doing that now with his reelection hanging in the balance, apparently preferring to be able to blame a loss in November on the virus and the cost of perhaps hundreds of thousands of American lives, than to give himself a chance of winning and a chance of saving them. Yeah, he doesn't give a shit anyway. We already knew that.